Dr. Mirunaaleni Selvaraju. I'm a Masters of Public Health student from University Malaysia. Today, I'm going to talk to you very briefly about the unmet mental health needs among the elderly population in Malaysia. Who exactly are the elderly population? Elderly population are those aged 60 years and above. They are not only our family members, but they also are volunteers, and in many countries, they are still an active participant of the workforce. According to World Health Organization, it is expected that by the year 2050, the total population of elderly are going to double from 12% to 22%. According to Malaysian projection, it's not much of a difference either. We are expected to see doubling in the number too, from 7% to 14%. This kind of projection in other nations, for instance in France, it took nearly 100 years, a century before they see the number of the adult population rising. But we currently have about 25 years only down the line. So, what actually is aging? Aging is a dynamic process. It involves not only the physiological and psychological, but also it involves the behavioral, social, and environmental aspect of the person. Some physiological changes are benign. For instance, let's look at the graying of hair. Although graying of hair might be benign and do not cause any health hazard, but it does have psychological impact on the person. Whereas other changes, like changes in the capacity and the capability of the person to be able to perform their daily activity, does have a significant impact on the quality of life of the elderly. They lead towards disability, frailty, and as well as increased susceptibility to get medical illnesses. Do remember that just aging itself is one of the major factors to a lot of chronic illnesses. So, are we ready to cater to our elderly population? As we know, the number is rising very fast from 5 years down the lane. What do we have actually in our current setting? We do not have enough geriatric psychiatrists to cater to their mental health needs. We do not even have enough geriatricians to meet for their biological, general physical. But what we can do now is we need to reinforce our pre-existing primary healthcare practitioners, our family medicine specialists, our medical officers, paramedics, nurses, and medical assistants should be trained and increase on their skills for relating to mental health issues among elderly. And this will ensure that we can pick up early signs and symptoms in relation to it and refer those who direly need the referral as soon as possible to the correct channel in order to ensure a better or a positive outcome or impact on the elderly person. Apart from that, what else can we do? From the community aspect, we need to enhance the social support system that is available for the elderly. We can provide more NGOs, more associations, whereby they have an avenue for them to perform activities like physical activity, doing more meaningful activities like gardening, or even a place for them to sit and chit-chat among the elderly age group, and as well as sewing or any other activities that would give them a life satisfaction here. And with that, they could have a reason to feel they have a functional capacity where they can still move on. Not only that, we also have to ensure that our elderly population is well fed. Malnourishment is also a very significant issue among this elderly age group that has to be catered. Not to forget, with aging, they also have a lot of experience. Not only by life experience, losses and grief are also a significant part of their life. So, in a nutshell, in order for us to cater to this elderly age group, who was once a very important, very dear people to us, we need to ensure that every aspect of their need, be it from the physical, mental, or even the environmental, has to be inculcated, and every action that we make has to also have the thought of them in our mind. A good policy which would enhance and also support and nurture our elderly population will be a very important weapon in order to give a very positive elderly or old age life. Thank you very much for listening. Have a Have a great day.